This is our work with a wireless wearable technology that Johnny just introduced to you. These are validation studies that we have done and other investigators have done based on this technology. This study that and I'm showing you part of the data. This is its comparison in our CVICU in 45 patients and more than 1,000 data points, looking at the comparison of the non-invasive pulse decomposition analysis against the arterial line, systolic and diastolic blood pressure. It's fairly good correlation, I would say here, 0.89 and 0.87 on each side. More importantly, and we published this work in the Journal of Clinical Monitoring and Computing, this is the comparison of our CCO swans on the y-axis here against the cardiac output from the pulse decomposition analysis device, the Caretaker device. And again, the correlation here is on 41 patients with more than 15,000 data points. Correlation is moderate. The limits of error are 37%, 37.5%, which is within the 45% for non-invasive continuous monitoring devices. And even looking at a concordance analysis, things look pretty good here. And not just us, this is a group at the Cooper University Hospital. They did a similar experiment. They did discrete thermodilution as their comparator. We used CCO swan as our comparator. And again, they've shown a very good correlation against the discrete thermodilution and an error of 38%. And at Cooper, again, this is their work with the CCO, more than 2,000 data points compared against the Caretaker. And again, their concordance, they looked at on the left side of the panel, no delay whatsoever against the CCO. And then they factored in the CCO delay. And then when they factored in the CCO delay, the concordance was 0.86, which is, again, very good concordance for any validation study.